I'm very happy also. My family also very happy.
Hello, അമ്മേ സുഖാണോ? എന്തൊക്കെയുണ്ട് വിശേഷം?
I am very fine.
Very good. Hey everyone, I am Dr. Yatish. I am with one of our amazing patient, Shantakumari here. She had a unique experience and she has undergone both knee replacement. On one side, she undergone conventional technique. The other side, on the left knee, she undergone a robotic knee replacement. And this is the fourth day on the left side and eighth day on the right side. Let's see what's the difference she felt during this experience. I'm thankful to our patient Shantakumari for sharing your experience. Since how many years you are suffering from the knee pain?
I think maybe 7 years I am suffering from my.
Okay. So how was it affecting your daily life?
Oh, my life is very sad. I am affecting for very sad because for I cannot walk and then I cannot run. I cannot enjoy my daughter.
Now you are right now you are staying in
staying with my daughter in Dubai.
Okay, so you are looking after your grandchild.
Yeah, my.
Okay. Which standard he is studying?
He's a nursery now, KG1.
Okay, you are always taking care of him. Right?
Yeah.
Okay.
Because my daughter.
So I think he must be running everywhere. Right?
Yeah. Running. I can't for the catch for. I can't manage for my son.
Okay.
Because he's always.
So you are running behind and you are because of the knee pain you are not able to.
Yeah.
Okay. Sitting was also problem.
Yeah, sitting also problem. Sitting after that I cannot move.
Okay.
That is the very problem. I am catching somewhere and then I am moving.
Okay.
Like that.
And the climbing stairs.
Climbing, I am not. I don't climb. I am not climbing for any staircase, anything, because my leg is not coming up.
Going to the mall with your grandkid was
No, everywhere I am not going. Only sitting at home.
So you are not going to any function.
Any function.
Sitting in the home.
I can't avoid like that function. I will go. That also taxi or car. I am going and then coming back.
Okay.
I am not enjoying. Only going for sitting somewhere and then coming type.
So you had knee pain both the side, right?
Yeah. First starting for the left, right. After that, starting for the
left. How do you came to know about this knee replacement surgery?
Because I am in Dubai, hospital. I went there. That doctor also telling any treatment, only knee replacement. I am after that. I have no insurance, nothing. Okay. That's why I am coming back. Okay. Shifa, my colleagues is before working Al Shifa. And then I call that guy and then he's talking with friends and then he's telling, okay, come here is better. Okay. Then I am coming here and then I meet for the doctors. Okay. And then I feel nice.
Yeah. And so we had a conversation with you. So when you came here, knee pain, and it was affecting your activities of your daily living. And the X-ray, we took an X-ray, and it was showing a significant osteoarthritis. And we advised you total knee replacement. First, we did a conventional knee replacement for her right knee. And so how was the experience on the right side?
Much pain in 2 days, very much pain.
Initial first 2 days you had pain, right? At the night you had pain?
No, sometime is coming
for sleep in the night.
No, I'm sleeping, but sometime is.
No, if I scale the pain from 0 to 10. So how much was the pain scale as per you?
0 to 10.
In the first 2 days.
First 2 days 5 like that. 5. After that reduce is 3.
The sisters gave you the medicines, right?
Yeah. Regularly giving for the injection and then tablet and then everything.
With the pain, you are better.
Yeah. Any small things also sisters coming and then doing, because first surgery finished that day, early morning I feel for the headache. Then I called to the sister coming and then spray for my nose and then half an hour I am released and then I am okay. Then I sleep. Everything is careful for the staffs here.
So I you like the care. Okay. So after 3 days you felt better with the right knee. Okay. Initial 2-3 days it was a little problem. That too, it was bearable, right? Only the pain score is 5, not 10. Only 5. Okay. So we did a replacement on the left knee after 5 days, right? So it was again as requested by you, and you said let's try a robotic on this side. At the 5th day, we did the robotic surgery on your left knee.
Yeah.
We advise you to take the CT because in the robotic knee, it's a precision surgery.
Yeah.
So here we have to take a CT scan. Okay. So day before we took a CT scan.
Yeah,
so
yeah.
how was the experience of
The CT scan.
Okay.
My life first time CT
Okay.
scan. Yeah.
So the people are actually afraid of taking
Everywhere,
CT.
I'm not feeling anything.
So you
I'm
felt
a
better.
normal scanning feeling like that I'm feeling.
Okay,
I'm
so-
CT scan. My sister also asking for you injection for like that. I said no, nothing.
Okay.
Only I go inside and then coming back, and then little time after that going inside and coming back. My leg.
Okay.
Only for the my leg. My partner, no for the full full
only
body.
the leg.
Yeah.
We'll take the CT
Yeah.
from here to here, whole
yeah.
limb, and then we'll plan surgery accordingly.
Yeah.
So the CT scan taking experience was good.
Yeah, very good. Feel I'm very good. I like very good.
Okay. So the next day we did a surgery. You know why the pain happens in any surgery? Because after any surgery, it's like a injury. The tissue is getting injury, right?
Yeah.
So when you do surgery, we are making some incision and we are opening the joint and we are replacing the damaged joint and with a new metal coating. The first stage after tissue healing is inflammation. Inflammation is usually associated with the pain.
Yeah.
So usually it lasts for 2 to 3 weeks. That's why you have the pain after the surgery. In the normal conventional knee, to correct the alignment, usually your knee was like a bent, right?
Yeah, now bend is gone. Before
it was bent
yeah,
that
like
side.
that.
Now,
Before now bend is gone.
now it is
Now
straight.
it's
So to make it straight, on the tighter side, we do some releasing of the soft tissue ligaments. We make it loose and then make it the limb straight. In the normal surgery, we do little more tissue trauma. In robotic, we are not doing any the release or a tissue injury is much less because we are correcting the alignment, just adjusting the components position. Okay, so that's why tissue injury is less in the robotic. So the inflammation is less, the pain is less, and also we are not touching any ligaments and you feel much natural. You tell me, how is the experience of your left knee? Immediately after the surgery, you had a pain score 5 on the right knee. 2 to 3 days after the surgery, you had a pain score of 5, right? On the right knee. So how is your experience on the left side, which you undergone a robotic surgery on the left knee?
So after robotic surgery finish, after that is bring for my room. That time I am not different feeling.
Okay.
So that time because this one also paining, this also paining. I am not refrain that day. But that day night I am nicely sleeping. After that morning is coming, no problem. I am very easy for my because right is very hard. Because second day I feel for the very hard my leg.
The right knee.
Right. But left is no hard. I feel like that. I can't move. I can't bend like that. I will move and bend. Everything is right.
Right side.
Next time. Left side. Next day. Right is no. Right is 3 days.
3 days it was.
3 days I take. 3 days I left.
Right side it was.
Right
more.
side is
on the left side.
Left side is only one night.
Only one night.
One day. Second day morning, doctor coming and telling you do the exercise. I am starting for the exercise.
Okay. So you are much better on the next day.
Very much better. Very much better. And then after 3 days, now is fourth day.
Okay.
Doctor also, main doctor also coming, and then I am walking. He's looking. He's telling you don't want use for the walker. Sometimes because of aged, no. That's it. Sometimes some words is forget. Walker. You don't use the walker. You use for the stick.
Okay.
So I am very happy because only my left side is only 3 days. Fourth day, this one. Fourth day I can use for the walker. This is for the I feel better, no? Better for the my heart is feel better.
Okay. Okay, let's see how is her difference and with respect to the swelling. How is the swelling and the pain?
No, now it's okay. Now
day 3. No, this is day 4, right?
Day 4. Space swelling because I cannot touch. I touching for the some wood like that. I touching time I feel.
On the right side.
Right side. Left side no. Left side is very soft. Very soft.
It's not
very soft.
Swelling is also
swelling also no. And then I can I will do like that also. Right side not. Right side now is okay.
Okay, so let's see some of the common physiotherapy we do. The first one, so this is a static quadriceps exercises. So can you do on this side? Press it down, press it down, press it down. Okay, relax, press it down, relax. Here also you do, press it down, relax, press it down, relax. Okay, the second exercise we advise is the ankle movement. This is to prevent when the blood clot here. Okay, so can you do this one? Yes. Okay, so this is the exercise to prevent the blood clotting here, this muscle. Okay, the next is the sliding exercise. You bend your knee, bend. No, madaka. Bend your knee. Yes, that's the. Relax. Straighten. North. Bend. Straighten. Bend. Okay. So this is the sliding exercises to get the range of movement. And then next is the straight leg rising. Yes. Down. This one. Lift up. Okay. Down. Then one is static quadriceps, and then pressing down,
and then
sliding exercise, lifting, and then moving the ankle. So which knee you felt easier to do these exercises?
Easy for this one.
Right side is easier.
Now is together is okay.
Now together okay.
Now together okay.
Now this is actually 8th day, no? So you may feel little better. Right side.
More than better. This one, this feeling.
You are feeling much better. This is already
8 days finish.
You are feeling better.
Yeah.
And this side.
This one only 4 day, no?
4 day. So if you compare 4 day on both the side, so which was like easier for you?
This one.
This one is easier.
Left one.
Left one is definitely.
Of course.
There is no doubt.
No.
Okay.
No doubt. Any doubt.
So this is also good, but
this one is a 4th day. This one is good.
Okay. So you are feeling much better. You can do exercises easily. Just 4th day itself, right?
Yes.
On the left side. Now let's see how is your movement and bending the knees. So let's see how is her bending knee movement. Okay, so this is on the right side, normal conventional surgery. Straight. Okay, other side. Bend. Okay, rendu orimichu bend edo, rendu together bend the knees together and straighten. Okay. So the both are same for you, or is there any
little pain? This one.
There is a little pain on the left side.
This one is more than pain. This one not too much pain.
Okay.
No, normally.
Okay.
This one little more pain because for only 3 days.
Only 3 days. So if you compare the 3 day,
3 days
definitely.
This one for this
so
one.
So how many days it took to become like this on the right?
I think maybe 5 days.
5 days.
5 days because 5 days. That 5 days also I had doing time. My
movements was little painful.
Close the eyes and then I.
Okay, like you used to do like that. Okay. Now you are feeling.
Now is easy moving.
Okay.
But this one is no need for that. Close the eyes and then suffer.
Okay.
So suffering and then moving that.
Okay. ഇനി അപ്പോൾ നമുക്ക് നടക്കാറുണ്ട്.
Doctor telling normal walking.
Okay.
That's why I am today starting for the normal walking.
So today onwards we advise to use a stick. Right? Okay.
Then.
So how is walking?
My confidence, 90% I am confident.
You are confident?
Yeah, 90% I am confident. But I am not following for the doctor's advice.
Okay.
I am confident, okay, but I am not.
The surgical approach is same for both the knee. Parapatellar approach in that we cut the muscle and open. So usually
now look,
usually
I'm straight. I'm straight also standing.
Usually to get the muscle strength back, it needs around 2 to 3 weeks in this approach. So that's why we are telling you to use this. Are you having any pain in the knees now?
Little, because for the surgery finish, no, that's a little bit. But
no, when you stand on your leg, is there any pain now?
Little paining.
Only little pain.
Yeah, little paining.
Little pain.
Yeah.
It is not bearable.
Yeah.
It's bearable pain.
Yeah.
So what is the pain score now?
Now taking for the vein injection
10,
like that.
No, 10 to 0 to 10. What is your
0 to 10, so 4.
4. So okay, less than 5 is okay. How was the pain when before doing surgery
Before doing
is it the same?
surgery, I am more paining because I cannot do little time walking. That time I feel I want to sit. I sitting time I'm back pain coming. I want to sleep like that. And then
Now you are
long
much better.
I cannot travel for the long time for the car because I cannot sit. Bus also I cannot going for inside the bus because for the staircase is up, no, like that.
Okay.
So house only little work and then paining also, painkiller also eating. After that my stomach is ulcer coming.
Oh,
That is the main problem. Say
you are now around, what's your age? 60?
66.
66. So we have replaced both the knees, and your age is now, it is not 66, it is 56 now. 10 years you are younger. Okay, because you have undergone the surgery and you are much better, and you need not take any medicines.
No. Now
and more than that, if you take a painkiller in this age, it will affect your
then colonoscopy, endoscopy also. If you doing finish after that,
so painkiller is not advisable
now
in this age.
at that time I stop with painkiller. After that, this medicine finish. After that, I want to consult for the gastrologist because for the my ulcer also I want to remove. Ulcer coming also this painkiller. Because I am too much painkiller eating. Because by evening I cannot sleep. I cannot going for the bed. That time I am taking for the painkiller and then I am little.
Okay, that's great. Ignore me. Thank you, Shantakumari, for sharing your story with us. And I hope this is useful for the who are undergoing this surgery. She had undergone the conventional knee replacement on the right side and the robotic knee replacement on the left side. Both the knees are doing well. As per her experience, the left knee is recovering faster as compared to the right knee, which is the robotic knee is doing good work with respect to the recovery as per her experience. So what is your final words to our viewers?
I will advise for everybody. Is your replacement nail replacement time you will easy for the robotic because you are manage for your body and then easy for the robotic. And this one, other one is I didn't know good but easy.
So this is also good, doing well.
Because first time I do no, I know very well. Together I know, no. That's it. So it's better for the robot.
I think you are the best person to tell us that because you have undergone normal one side and robotic on the other side, and you can definitely make the difference because you are experiencing the difference. Both are good.
Both are good, but more than easy. Robotic.
You can do exercises easy, swelling is less,
walking easy, fast release.
So you are out of medicines very early. So you took 2 to 3 days to make yourself better on the right side. But here it's only one night. So
one
you
night.
are better. Okay. So thank you for sharing your story.
Thank you, sir.
Thanks a lot.
Thank you so much.
Yes.